Good morning. So, after completing logotherapy, now I am going to start Morita Therapy, in which, in the same decade, the logotherapy came into being. A few years earlier, a fact, Shoma Morita created his own purpose center therapy in Japan. It proved to be effective in the treatment of neurosis, OCD, and post traumatic stress. In addition, many Western form of therapy focuses on controlling or modifying the patient's emotions. In the West, we tend to believe that what we think influences how we feel, which in turn influences how we act. In contrast, Morita therapy focuses on teaching patients to accept their emotions without trying to control or suppress them, since their feeling will change as a result of their action. Morita therapy is not meant to eliminate symptoms. Instead, it teaches us to accept our anxiety, fear, desire, and worries and let them go. Morita explained the idea of letting go negative feelings with the following fable. A donkey that is tied to a post by a rope will keep walking around the post in attempt to free himself, only to become more immobilized and attached to the post. The same things applies to people with obsessive thinking, who become more trapped in their own suffering when they try to escape from their feelings and discomforts. The basic principle of Morita therapies are: first is accept your feelings. If we have obsessive thoughts, we should not try to control them or get rid of them. If we do, it become more intense. So Morita linked emotions to the weather. We can't predict or control weather. We can only observe them. Second one is do what you should be doing. We shouldn't focus on eliminating symptoms because recovery will come on its own. So we should focus instead on the present moment. And if we are suffering, on accepting that suffering. Above all, we should avoid intellectualizing the situations. The therapist's mission is to develop the patient's character so he or she can face any situation, and character is grounded in the things we do. Third, discover your life's purpose. We can't control our emotions, but we can take charge of our actions every day. This is why we should have a clear sense of our purpose. And we always keep Morita's mantra in mind: what we need to be doing right now and what action should be taking. So, the 4 phases of Morita therapy, which last 15 to 21 days, they consist of the following stages: the isolation and rest. 5 to 7 days, the patient is isolated from external stimuli. वो किसी रूम में बंद करके, मतलब एक रूम में बंद रहते हैं और ना फ़ोन मिलता है उनको, ना फ्रेंड है, ना न्यूज़पेपर, ना बुक, कुछ नहीं उनके पास है. ओनली उनको थेरेपिस्ट से मिलना है, और थेरेपिस्ट उनको सजेस्ट करते हैं कि ओनली लिव विथ योर फीलिंग्स के अप्स एंड डाउन्स, लोज एंड हाइज, जो भी आपको हो रहे हैं, यू कीप ऑब्जर्विंग दोज फीलिंग्स, और कुछ नहीं करना है. देन वो ओनली अपनी फीलिंग्स में रहते रहते व्हेन द पेशेंट गेट बोर्ड एंड वांट्स टू स्टार्ट डूइंग थिंग्स अगेन, देन ही इज़ रेडी फॉर द नेक्स्ट स्टेज. अब नेक्स्ट स्टेज में क्या है? लाइट ऑक्यूपेशनल थेरेपी. इसमें भी 5 to 7 डेज होंगे. अब इसमें क्या है? पेशेंट टू परफॉर्म repetitive task in silence. One of these is keeping a diary about his thought and feelings. The patient goes outside after a week of being shut in, takes walks in nature, and does breathing exercise. He also start doing simple activities such as gardening, drawing, painting, etc. During this stage, the patient is still not allowed to talk to anyone except the therapist. Third one, occupational therapy. It also consists of 5 to 7 days. In this stage, the patient performs tasks that require physical movement. Now Morita like to take the patient to the hills. वहाँ ले जाके उनको बोलते हैं कि chop the woods. In additional physical task, patient also immerse in other activity like writing, painting or ceramic making. The patient is allowed to speak with other but only about his task. Now fourth one is the return to social life and the real world. The patient leaves the hospital and is reintroduced in social life but maintain the practices of meditation and occupational therapy developed during treatment. The idea is to re-enter society as a new person with a sense of purpose and without being controlled by social or emotional pressure. Thank you.